All right, welcome back. In case you're just joining us, it's time for our conversation right now. Before the break, I did say I'll be joined by Governor Peter Obi. He was the former governor of Anambra State as well as the PDP vice presidential candidate. Welcome to you, sir. Good morning. How are you doing?
Good morning, Nancy. How are you today?
I'm well, thank you. Let's get straight to business. Let me ask you first what your sentiments are since we had this the first case of coronavirus in the country in the month of February till we went on a lockdown. Now the lockdown has been eased. Speak to me about your sentiments in just 1 minute, what you think about since the infection came into Nigeria now.
Well, Nancy, I have to stand by, of course, thanking and appreciating all of you at AIT for the wonderful work we're doing. And I assure you that myself and all women in Nigeria are in prayers for your founder, your chairman, and his family for quick recovery from this pandemic that we're all going through. I also want to appreciate our heroes. I mean, the healthcare workers were at the forefront of this. And also the federal government, state governments that are doing whatever is possible to contribute in what is happening. And all Nigerians were in one way or the other, including those who were locked down, who sacrificed a lot. But like I said at the onset of this, you could see that up till now, we have not really taken care or control of the situation as it should be. Because the most critical measure of how this is spreading, we are still not in control of it, which is testing. So for me, issue of lockdown and relaxing it, we also have to go all through this with very serious caution and follow strict protocols. Because while some countries can say they're in control of the situation, I think the virus is in control of the situation here. We don't really know what is happening, and there's need to do a lot more work.
Okay, you said there's need to do a lot more work. If we're taking a look at what's been happening, of course, we went on a lockdown. The lockdown has been eased. Did you think that while we were on the lockdown, they did control the spread of the virus?
Well, Nancy, nobody can actually know, nobody can tell you yes or no, because even with the lockdown, if it went up. But if you look at the most critical measure, like I said, the most critical measure of the situation is testing. If you compare us with some countries today, even as I saw in your news this morning, you could see that the percentage of our testing and those who tested positive is very high compared to other countries. As at yesterday, I don't know what happened this morning because you might have a more recent thing. If you look at South Africa, for example, they've tested 324,000, about 324,000. And those who are positive is less than 10,000. So in percentage, it's just about 3%. If you look at Ghana, they've tested 155,000, and they have just a little bit above 4,000 positive. Again, in percentage, it's about 3%. If you look at Egypt, they've tested about 105,000, and again, they have positive about 10,000. In percentage, you're looking at about, call it about 6-point-something%, or 8-point-something%. So if you go, even small other countries like Philippines, which I always compare with us, they've tested at 163,000. So every country you've seen that is of our size or within the same trajectory, we have ramped up their testing, and they are below 10%. In our own, we're just about 23,000 plus, and we are 4,000 plus positive, which shows that we are about 17.5% or above that. So you could see that in percentage, we've not done a lot of work. If you take it tests per million, South Africa have done about 5,500 to 1 million. Ghana have done about 5,000 to 1 million. Egypt has done about 1,000 to 1 million. And we are 116 to 1 million. So we have just done about 10% of the countries you can compare us with in Africa. It shouldn't be. So there's need to ramp up the testing in order to ascertain what is happening. And again, I keep saying that as a nation, there's need to communicate more on, again, issue of testing. If we are importing testing kits or we are getting more testing kits, if we are setting up more testing centers, which we need to do aggressively in every other state, some states still don't have testing centers to date. That is unacceptable because you cannot have a situation where South Africa have over 70 testing centers, Egypt, which is the third biggest economy, have 50 testing centers, and we are still talking about 20-something. It should not be in every state. Setting up this is not a rocket science. I keep saying it whenever I have opportunity. So we need to do something quickly to be able to know, and we need to be prepared for the spread. How many isolation centers we have? How many beds? What are the equipments we have? When you come to the most critical equipment for isolation center, everybody knows is ventilator. How many ventilators do we have in this country? I can tell you how many ventilators that is in Egypt, in South Africa, but I don't know how many is in Nigeria. These are things people should know.
Okay, so let me halt you at this point, and let's take a look at when we're all in the lockdown, until the president made the speech and eased the lockdown. We've seen, at least in the last 1 week or so, we've seen a very sharp rise in infections. I was chatting with my colleague earlier, Benga, and he was telling me that the NCDC says, okay, now because they are doing more testing, that's why we're seeing a rising cases. But do you think that the sharp rise in the cases of infection is also directly proportional to easing the lockdown without Nigerians being socially responsible?
I mean, Nancy, you can only look at what happened in Germany and South Korea. Places we use as an example, or everybody uses globally as an example of the best in terms of management of this. As soon as they relaxed the lockdown, they saw sharp rise in the whole situation. And I can tell you that is going to come. Even when we have increased testing, we've not been able to test enough. Like I told you before, there's some states who don't have, any testing center. How many do we test in a day compared to, say, Ghana or South Africa or Egypt? These are countries that we can say, and we're no longer comparing ourselves now with the Western world. If you go beyond here, it is even worse. So what are we testing? So it is unless we ramp up the testing that we can know what's happening.
Do you think that we lifted the lockdown too early, or we went into a lockdown too early? Did we lift too early? Did we go into a lockdown too early? And are you of the school of thought that we should go on another lockdown to control the spread of this virus before it overwhelms us?
Quite frankly, when we went for the first one, I would say it's not whether we are early or not, it's that we didn't plan properly to be able to put in place the stimulus to manage that process. You have to manage the process. So again, relaxing it or saying we will go back again, if we're going to do anything, we must put in process palliatives to manage the process. We didn't put that in place. That was what happened in the first place. So you have a situation where within the first 2-3 weeks, people have reached the limit of their sacrifice. Like I said, people were almost dying of hunger. So they would rather say, oh, listen, let's die of this disease than die of hunger. We know if we are going to do a lockdown, that we need to sit down and look at what is happening in other nations, study properly, put in palliatives. We know it might not be 100%, but people have to see something that is meaningful. Before we have this situation, everybody knows from Nigerian Bureau of Statistics that we have 40 million under and unemployed persons. Of course, from them, they are saying it's 82 million living below poverty. World Clock is saying 98. But let's take their own, that is even 82 million living below poverty. Now see, if you take this and look at what is happening in other countries, so you can imagine the number of people we need to plan for before lockdown. A country like America, the world's biggest economy, with a population of 328 million, their workforce is 164.6 million, which is about 50% of their population. And unemployment before the situation of this pandemic started was 5.5 million, which is just about 3.5%. Now, you see it yourself, it is now over 30 million, 18% unemployment in America. If I use another Western world, UK, 70 million in population, 34 million people employed, with unemployment of 1,640,000, which then was about 4.5%. Today they are 7 point something, which were moved to almost 20%. So you cannot imagine us, you can go the same thing with Indonesia, with India, I can go on and on, but you could see that with this situation, the unemployment rate in various countries rose. So in our own situation, with 40 million as a starting point, there's no way we have less than 50 million. So if you're going to plan for a lockdown, you plan with at least 40 million, which is where you are starting. India with 700 million people employed, India, what they did is to plan with 200 million. So in our own situation, we did not plan for the lockdown. What you see is that we just, of course, came in with even something that shouldn't be part of the lockdown, conditional cash transfer, and said it's down 2 million people, 3 million people. You have a situation where you have 40 million people. So you cannot be planning with 2. You have to plan for this 40 million. And we have to look at the models that have happened in India and other places, where it is a mix of, you're going to give them a little bit of food stuff and some money. In India, they gave the women, the poorest of them, they gave, I think, about 3 or 4 kg rice and $6.
Okay, Governor, let me hold you there. I've heard your analysis on different countries, but I can also take you up on some of those countries, like the United States, which you talked about. Last Friday, like I said earlier, over 20 million people are out of work, unemployed in the United States. I was listening to Larry Kudlow, who is one of the advisors to President Trump. He did say that they are hoping that some of them will come back to work because it's just temporary unemployment. But in the case of Nigeria, we may not say that. If you lose your job, you've lost your job, but you may not even have the means of getting another one or being hired back by the company that fired you. Where am I going to? The National Bureau of Statistics released 82 million Nigerians, 82.9 million Nigerians are poor. We see a lot of people unemployed at this time. we've also seen the palliatives that different countries did. The U.S. signed over $2 trillion check for its people, giving them $1,200 paycheck, and they even did more when Nancy Pelosi and her team also came forward. What meaningful things do you think the government would have done? What meaningful things? The president said, let's have 1 million added to the households, making 3.6 million households. What are like 3 steps from you that the government would have done, bearing in mind that the government right now do not have the financial muscle to pull off some of these stunts?
Well, Nancy, I'm talking about, let me start with what you said. Adding 1 million to the households is different. We're talking about 2 different things. Conditional cash transfer was something that was designed to help poor families to send their children to school. You can go and follow it up from what happened in Mexico and in Brazil.
Yeah.
This has nothing to do. It's been on there. When I was in government, I left government 7 years ago, and the conditional cash transfer was there. It was in my state. In fact, that was what made us to do a study in our states, to do poverty mapping, to know where the poorest people live, which I can tell you that made us to start developing rural areas like Aya, Belmont, this in Anambra State. So it was there. This palliative is something that came up with the situation we find ourselves today. So you cannot go and take that process to manage this particular situation. No, that process is different. That process is supposed to go on its own, separately. If you're going to add people, you can add more families because there's more families to be added. But this particular situation we find ourselves, Nancy, requires that we look at what other people are doing. That's why I said they don't want us to look at what US is doing. They have the war chest to do it. But I want us to look at what India, Indonesia, and then countries in Africa are doing. We cannot continue saying we have no money. I agree that we have no money. I agree that things are difficult because yesterday, instead of us saving, we consumed everything, which I'm going to come to later on. So, but where we find ourselves now requires that even if we are going to borrow, like we're trying to do now, let's know clearly we're trying to borrow money to be able to do this. Most of these countries that are coming up with palliatives don't necessarily have the money. They're also borrowing. But in their borrowing, they are more transparent and saying where the money will go to. Most of the people you see that you have to take care of here are people who live from daily income. And there are millions of them. We are not going to fulfill what they get daily, but we can do something. And that's why I say we are going to do a mix of, okay, we are going to provide this amount of money for each person. We are going to provide this amount of foodstuff. Well, with what we have now, even you, Nancy, you cannot explain it. Even these things we say we are putting in place, even distribution of foodstuff we are doing, nobody can tell you, oh, it has been perfect. You just see maybe a group of 10 people or one village comes from one place, somebody arrives with and says it's coming from where they've distributed, he brings a bag of rice and 2 cartons of Indomie. In some other places, they cook the food and everything. You find out that before they arrive where they will share it, not even half of the food came there. So there's a mix. We need to look at models that work in other countries that have similar trajectories as us and do the same thing. We're not going to get 100% result, but people want to see 100% effort.
I would still want to get your view because it seems I didn't get you well when I asked the question earlier. Are you going to canvass for perhaps for another lockdown because of the sharp rising in cases, the sharp rises in cases? So are we going to be looking at,
I
because
won't canvass for that, Nancy, until we get it right. If we decide that today, for example, let's take 40 million, the number we're sure of. We know, at least this is on MDS. And we decided this 40 million, if we are going to do shutdown, two things is what it needs to be put in place. One is ramping up the testing. Nancy, we are 200 million people. If South Africa, let me go again to South Africa, has over 70 testing centers, if other countries have this, if we can decide today, they have just 55 million, we're 200 million. So which means we need at least twice the number of testing centers.
So the question is, I don't want to speak for the NCDC, but I feel that they would also want to increase testing centers. What is making us not increase testing centers? Is it a matter of availability of funds to get those testing centers, or perhaps the state government should come in here, and these are state governments now that will be reeling from all price plunge?
I remember hearing from the Minister of Finance a few weeks ago that they've gone to assess these millions of dollars from IMF, World Bank, strictly to support this process. We have been hearing about billions being contributed by people, of which small people like me contributed our own little token. And I'm saying, all this cumulatively, let us know this is not rocket science. Other countries are doing it. Let us know that, okay, in the next 1 week, for example, or 2 weeks, or whatever time, we are going to increase testing where we're going to be doing maybe 20,000 a day. And we are importing, or we are buying, or we are providing, or we are manufacturing any which way about 500,000, 1 million test kits. And within that time that is available, we've chosen this number of people, let's say 40 million, and we are going to pay them 10,000 naira each, equivalent. Let's spend 10,000 on them. That's 10,000 on 40 million, which sounds huge. That's what it will be. But if I expect it, it's going to be about 400 billion, it's about $1 billion. Huge amount of money. But if our GDP is 400 billion, 1% of it is $4 billion.
Okay.
So if you use 0.025% of it to keep people in one place for 1 month, to be able to ramp up testing and take control of this virus, it is not a waste. It is a good expense.
Okay.
But we need to put all this in place before we go. So all those monies that are tested, that are contributed by very wealthy people, all the ones that are donated by other organizations and countries, we need to put them together. We need to know what are they using it to do. We need to know, as I said, we need to know every minute what do we have. If today, China will give, say, New York, 1,000 ventilators, they will report it. New York is even reporting 16 ventilators that come from one people's home. If you go to their system, you see it. And here, you just hear that there's this money, there's this money, there's this money. You don't hear what happened thereafter.
Okay. You've raised a very valid point, which I've been saying all the while on the program, you know, about the transparency of the process of the funds that we are using right now. I read on The Economist magazine just a few days ago about this process of managing or trying to battle COVID-19 is also an avenue for corporate fraud, is an avenue for fraud to happen. So as citizens, we should begin to demand explanation as to how much is being spent so far. Moving me now to what you had actually
Not
mentioned.
just how much is being spent. Let me cut it, not how much is being spent. Only tell us you're buying, if you're buying testing kits, I keep saying it, tell us you're buying testing kits at this price. Everything today knows the price. I know price of testing kit. I know price of ventilator, and everybody knows it. We know price of face mask. I've been seeing even say, so anybody saying they're going to provide face mask. At what cost? If it's free, let us know who donated it. You know, if it's cost, let us know how much it is, so we can compare. Because even when they said it's being provided, at what cost? This testing center, what does it cost to provide a testing center? I used to say like Anambra to give example. When I did it, Anambra has 2 teaching hospitals with a lot of professors. One is the Federal University Teaching Hospital, Nnaji Teaching Hospital, and I have the state one. If those professors there cannot set up a simple test center, then they should not be there. That center is not this thing. So there must be an amount of money we can give them and say, this is what we need, and wrap up the whole thing.
Okay, let's go to the aspect of what is staring us in the face right now. 2020 budget. The Minister of Finance did say just a few days ago that oil price benchmark will be dropped further to about $20 US. They had initially dropped it to $30 US. We know what Brent crude is doing right now in the international marketplace. Just a few days ago, WTI plunged into the negative territory. What does all this portend for the economy moving forward as it concerns 2020 and perhaps our lack of savings that we've seen? When you talked about Ghana a little while ago, what came to my mind, what Ghana is doing right now is that, of course, Ghana is an oil-producing country right now. Ghana took 1.2 billion cedis from its stabilization fund, like we took $150 million from our own stabilization fund. Ghana took 1.2 billion cedis out of its own stabilization fund, 600 million of those cedis going to support businesses, 280 million are going to provide food, water, and sanitation equipment for their citizens. Then the remainder going to frontline health workers in this case. So you're seeing like a holistic, or something like you said earlier, let's actually know what is happening. Are you seeing that clarity? So I've asked you 2 questions right now: our budget, savings, and the clarity of it.
Nancy, our budget, I think for 2020, Nancy, for me, 2020 is gone, because there's no way we will be able to do anything this year. Our budget was actually, you can say, it's on a life support before we came to this situation. Because let me go back to 2019 so you will understand where we are this year. In 2019, our budget was 9.1 trillion, based on oil benchmark of $64. In the entire 2019, our revenue was only about 4 trillion. So you can say that the budget of 2019 had a deficit of 5 trillion. This year, we presented a budget, our initial budget approval was 10.5 trillion on a benchmark of $57 and production of 2.188. That's what we based it on. And our deficit was to be 2 trillion. We were going to realize from all revenues about 8.5, and deficit was supposed to be 2. Now you have a situation, Nancy, that the benchmark is 20, which is a third of where that was based on. And with low demand in oil and OPEC cuts, I cannot see us producing more than 1.4. So again, you are down to 60% of the reason. So this is a double whammy. And remember that most of the revenues, with the lockdown and everything, most of the revenues are oil related. And then if tax and everything, our tax is already very low. As you know, we are not one of those countries that are doing well in terms of taxation, because you have 19 million people who are living below poverty, People who are poor cannot pay you tax because they're not going to kill themselves to pay you for. They're looking for money to eat. So with all this combination, Nancy, you could see that we will be lucky if our revenue this year is up to 2 trillion. When government said they're moving the revenue, the deficit from 2 to 5, I said, well, that is good. But I can tell you, it will be up to 7 or 8. With that situation, we're in a crisis. The declining situation will continue thereafter. And because we have no savings, it's going to be difficult after this. But again, it is in difficult time that nations take decisions to be and build their country.
Now,
so I believe that after this,
let me butt in here, sir, and ask you. We've seen that various economies are on a lockdown. Some are gradually reopening. Those that have even reopened, like South Korea, I think they are going back again for a lockdown because we've seen what happened, the sharp rise again, second wave of infections. But if we see economies reopening, is there a kind of silver lining for us there? Because if economies begin to reopen, there will be more demand for oil. Will it improve our status?
Well, Nancy, will improve our status. This is not. I know this situation might be a bit worse than what we've been through in the past. But Nancy, we have always gone through this trajectory, and as soon as we come out, we will start again going back to our old ways. Nancy, it is very easy. People know what you can do, what is happening in every other country in order to develop, and build their country. What we need to do is that if we come out of this, let's start investing in those critical areas that will grow this country. It is not a rocket science. Everybody knows it's open to everybody, and we know what to do. All there is the will to implement what is required and what we can do in order to be able to do it. We are now borrowing from back center, from everywhere. This is time to now change and say, well, listen, we're going to borrow for productive sectors, strictly productive. We're not going to put the money where the money will work, where the money will come out with results. We can no longer continue to live as if we don't know what is happening in other nations. There's nothing wrong in borrowing, Nancy. But if you must borrow and put it in productive sector. If you do so, you not have a problem.
Okay.
I can show you.
Okay, let me come in with this question because we just have a few minutes to 12, and I want to, get in a few more questions before you go. The question about state governments and their handling of this crisis, because it seems that so much attention is on the federal government, the center. Are you worried about how the handling of this crisis has been across the various states in Nigeria? You were a former governor in the state. You know perhaps how much these governors have at the end of the month. How satisfied or worried are you with what is happening so far?
Nancy, I said it at the onset that this is an economic situation. Health and economy is the same thing. Health and economy is the same thing. So that it would have been handled within the economic council, economic management team, and be able to be properly coordinated. The states, I would say, are doing, again, like you said, the federal government, are doing to their limit. But let me tell you, this is a war situation. When there's a war situation, the federal government is in charge. This is no state planned for this. Just like no country planned for it. That's why you're seeing in America in the UK, in every other country of the world, that the federal government is the one supplying the ammunition for the war. What if you expect the states to do, if you expect the states to do a lot, is that asking them to go and build their own army, buy their own ammunition, when there's supposed to be a central government that is supposed to provide for everybody in a war situation. I said it before, that when I hear my own governor saying he wants 2 million for isolation center, for me, it should be given 2 billion, should be given 2 billion. Because every state now is supposed to have received a particular amount from the federal government for isolation center. They are supposed to have come up with what they have and everything. Every state is supposed to have a testing center provided and supported by federal. So it is a worst situation. It's a collective situation. You can even see some of the where they're saying they're going to borrow money to make sure that the amount of money they divide every month maintains a certain level. That is a problem of tomorrow. Dealing with this situation first needs, again, all hands on deck. Everybody, every Nigerian have to be involved to ensure that we pass through this stage.
Okay. Let's take a look at, in the last few months, the world has been agog with so much downside, negative news. Some of the upsides are also coming out. So sometime in the month of January, I think from January 2nd, when the stock exchange opened, to January 20, the Nigerian stock exchange was the best performing that time. Then we tanked a bit. Then just a few days ago, Bloomberg News also reported that Nigerian stock exchange is the second best performing stock exchange in the world. I took that news, I tried to be happy, but I also looked at it this way, analyzed it in the sense that in other economies, stock exchanges are the barometers to gauge what is happening in the economy. So what exactly is happening right now? Are you also taking that upside like I am?
No. It's not at all. The reason is that for you to do that, for a stock exchange of any country to be able to be that parameter you're talking, it must be up to 50% and above the GDP. Once it's below, is that our stock exchange is very, very shallow compared with what it should be. For example, the entire valuation as of Friday is 12.6 trillion naira, which is just about $30 billion. Nancy, the second biggest economy in Africa, South Africa, the stock market is about $1 trillion. $1 trillion. And ours, 200 million people, biggest economy is $30 billion. Our GDP is supposed to be 400 billion. If our GDP is 400 billion, for our stock market to have meaning and be able to contribute, and it shows that the economy is not driven by private sector. And that's what we've been clamoring. Let this economy move to where it should be. We need to have a stock exchange that is not less than a capital market should not be less than 200 billion. That is done everywhere. If you go to small countries like Philippines, that is number 14 in economy in Asia, the stock market today is 270 billion. Vietnam, that is number 22 in Asia, the stock market is $155 billion. Even coming on to Ghana with a GDP of $66 billion, the stock market is $20 billion. So you can have it. We're not doing what, yes, it's a good news because, they try to do. Our stock market, again, contribute little or nothing to the impact of the economy. The inequality here, as you know, is 157 over 157%, which shows that 1% of the richest Nigerians control over 80%
of the rest
wealth
of us.
So they are the ones who are involved in this stock exchange. 90% of Nigerians are looking for food. They don't even know what is stock, whether it goes up or down. In my village, maybe there's not up to 10 of us who knows even what stock is. The rest are just looking for money to eat that afternoon.
Okay.
So they don't know. So stock exchange going up, contribute little or nothing. Is this 1% that you are earning with more money? In a developed economy where people have more shareholders and everything, it would have impacted. And this is what you need to do in order to build demand. That's why we don't have domestic demand in Nigeria.
Okay, let me ask you these two questions, I think, before we hit the top of the hour. The NBS released numbers last week, poverty numbers. I really want to have your take on how we can move the poorest of the poor out of that, even away from COVID. The poverty reports says that 82.9 million Nigerians are living below $1.90 a day. From Worldometer, of course, we are more than that. We are not a good label, the poverty capital of the world. So is there a system or a mechanism that can actually raise the poorest of the poor away from that? Then the second part of my question, you take that question, the answers in like 2 minutes or so. The second part of the question is leadership through a crisis. Are you seeing sufficient leadership at this time? Let's go back to Ghana, since we are using Ghana as an example. I'm aware, I think Ghana started a 3-day retreat, COVID retreat, with its people.
Nancy, I don't want to cut you, Nancy, but I don't want to talk about leadership. Because whenever
Why?
I talk about leadership,
Why? You were a leader in Anambra State.
I'm a politician.
And you are a leader. You're still a leader.
I'm a politician, so I don't want to talk about leadership. But what I want to tell you is that Nigeria have to look at their leadership recruitment process. It is important, even post this COVID. We can no longer continue the way we're doing. You might have, and when I talk about leadership, I talk about from councillor to the highest person. So don't think I'm talking about federal government. There's a lot of people involved in leadership. You need to go from there. What we have now is a situation where maybe 1 or 2 people are trying to do something good, where the rest of them do. So it's a situation where you have maybe a company, an airline company that have 100, let me put it, 100 planes to fly, and they advertise for employment of pilots, to recruit pilots, and we are able to recruit only about 5 pilots and 95 drivers, who are vehicle drivers. So what it is that while the other 5 planes is flying, 95 of the aircraft are on ground because these people are not trained, they are not pilots, so they can't fly. So you find out that whatever the 5 is able to get, he will not be able to do. So you need to reverse that. Where 95% is pilots, trained pilots, why 5% can be drivers, then you can manage it. Otherwise, you're not going to be in air and you're going to run out of business.
Okay, the poverty.
What you're trying to do on the poverty thing, Nancy, has been done everywhere. Between year 2000 and year 2015, China pulled 439 million people out of poverty. Within 2015 and 2018, India pulled 170-something million people out of poverty. So it's all rocket science. What did they do? Nancy, we need to follow the development model that is prescribed for everybody. It's very easy. Invest in education. Invest in health. Support your micro, small businesses. That has been done every. Nancy, if you have time now, I will analyze to you how this can save us from poverty.
Are you encouraged with what you're seeing now? Bringing me to the question, are you encouraged with what you're seeing with what the government has put together, stimulus measures for the critical sectors of the economy coming from the central bank, as well as even fiscal measures from the government? There's a 50 billion naira for MSMEs to take advantage of.
Nancy, 50 50 billion naira, 50 billion naira. Let me even tax it by, 8 to make it 400 billion is $1 billion. $1 billion from this money you're getting for IMF, that's about what you need to throw in that sector. It is not, the sector is underfunded. We have almost 30 million MSMEs, or even divide that across with 50 billion naira. It is nothing. Now, presently we have in total bank lending about 15, the last time I checked was last year, about 15 to 16 trillion, out of which only about 500 billion is going to MSMEs. That is small.
Okay.
These are the people you need to fund, and fund aggressively, because they are the job creators all over the world.
Okay, I think we'll leave it at that.
You need to invest money in this. Invest money in education. Look at us moving our assets. All the Ajmajeris now, you see them moving from one place to the other.
Okay.
These are our country's assets. You need to educate.
Okay, I think
the factory workers.
I think we'll leave it at that. I would have some time again to engage with you as we continue to look at the situation. But I want to say many thanks for joining us today to take a look at the economics of the pandemic, and if there is a way out, there is a way out of every problem. Thank you very much, sir, for joining me.
Thank you, Nancy.
All right, that's the much we can